Even before the patient came on 6th 3/2020 by evening, and Jayashree madam was on duty that day. That day the 5 of the patients came, and they were taken swabs. At that time we don't know that they will be positive, but we have a suspicion that they are coming from Italy, and probably they can be a positive case of COVID. Because previously there were lots of patients came on observation, and they were tested as negative. So this time we were a bit cautious, and after 2 days on 8/3/2020 by 5:30 Sergeant sir called us and told that the 5 are positive and you have to come to collectorate to attend the conference by 7:30. So we 3 called, and we 3 were there at 7:30 in collectorate, and at that time we were together and telling what we will do. Means we hadn't had any previous experience, and we don't know any other doctors who had treated this case. So this was a challenging moment. Means it's hours within that we know that we are going to treat these cases, so we don't know what next. So we were in the conference, and at that conference DMO and collector was there. So we were together. We made it sure that we 4 are together, we 3 and Ashish sir, so that whatever is there we will discuss and tell. And Nandini madam was also there, our DSO, and they were telling how the patients were, and are you confident that you can treat the case? We told, oh yes sir, yes madam, we'll try. And that's what it started. So we were practically astonished what to do, and anyway we started asking our teachers. We had downloaded the guidelines, and for 1 week we were reading a lot. We were discussing. We 3 were always together, almost always in the hospital. And the first day I was asked to break the news, and I broke the news there, and they were like I don't feel that they hadn't expected that they will be negative. Probably they were also expecting that the results will be positive only, so I don't have a problem in breaking the news. So I broke the news first to the Italy returnees, and then to their contacts. And after that we started. The patients were having respiratory infection. We had started on drugs, and in 2 days they were improving, but in between we have to discontinue the drug because they were there for 25 days, and some drugs has to be given for 5 days, then for 7 days. And when we stopped the drug, 2 of them went back, and at that time we have to take advice from our teachers. We had taken the advice from Dr. Ravi Umar Kurup sir. He is the medicine HOD, Trivandrum Medical College, and ID Dr. Arvind sir. Actually he was so busy. We wanted him to be here to monitor the case, but he was there on call.
The 8th morning was supposed to be a usual lazy Sunday, and we were on like any other Sunday. We were supposed to get up late. So but at around 6:30 our sleep was broken by repeated ringing of a mobile, and when I took to see who is calling at this early time, I saw the number of Dr. Ashish sir, because I am used to getting his call at odd hours, but I never expected his call at 6:30 a.m. in the morning, and I was literally shocked. And when I took the phone and asked, so what's the important matter, 6:30 a.m. in the morning, he said you have to be in the collectorate at 7:30 a.m. to attend a very important meeting. and he just kept the phone after that. So I was literally shocked what happened. I was thinking, did I committed some grave mistake so that something great error happened, and maybe I was wondering like that some disciplinary action or something may be coming. So I just called Jayashree ma'am and asked, ma'am, what is this collectorate meeting? Ashish sir just called me. Then Jayashree ma'am also told me, oh, she also got the call. So I was thinking then something else is happening, and she just told me that maybe the swabs we have taken the other day may have turned out to be positive. So just before the meeting, we three were standing together and we were discussing, because it's a very challenging scenario we were facing, because of the 5 patients who came to us and whose swab we have sent, 3 were above 60 and 2 of them were having heart disease, and they were also having some other comorbidities. So we were also aware of what's the scenario happening everywhere else in the world, because at that time the death rate was rapidly increasing, especially those who were dying were of the older generation, and those who had diseases were dying very fast. So we were literally shocked, and we understood at that moment that it was a Herculean task which is ahead of us. So at that time Ashish sir also raised the collectorate and we had a small chat, and initially we thought, okay, if we may request DMOs that we may be permitted to refer the patient to Kottayam Medical College. Then after some time we 4 of us talked among ourselves and we decided we will take it as a challenge. So as Nazlimada has already told, we took it as a challenge and we started our treatment. But at this moment, just like any new venture, it needs an investment. And our biggest investment was the amount of trust the health minister, the district collector, the DMO, and our dear superintendents and RMO invested in it. That was our capital. That was an investment we had. And we were blessed to have a very dedicated team of staff nurses and all other paramedical staffs. So as a team and as a family, we moved forward. And in between the treatment, we faced several difficult scenarios, and we were put under immense stress, not by anyone in the authority, but by the scenarios we faced. Because during the course of treatment, we 3 had to underwent testing, and the time, that is the 48 hours that took for the report to came, was one of the longest 48 hours in our life. So because we are so scared that if we are not scared for ourselves, because we had met, if suppose our test came out to be positive, the entire district administration had to go into quarantine, because regularly we had meeting with all of them. At this moment, I like to especially highlight the support which was given to us by the entire Pathanamthitta General Hospital team, because we had set up a separate kitchen for them, and the entire district administration and our general hospital team supported us immensely. And it is because of that support and the support provided by the health minister and the entire Kerala Health Service department, we were able to achieve a good result. So that's it.
At first, Omina became negative, and she was 2 days prior negative than the others. So we have to shift her rooms, and at that time she was happy, and also she was sad that she was away from her husband. Then she was asking me, doctor, എനിക്ക് നിങ്ങളുടെ 2 പേരുടെ ഫോൺ നമ്പർ വേണം, 3 പേരുടെ ഫോൺ നമ്പർ വേണം, പിന്നെ നിങ്ങളെ കണ്ടിട്ടില്ല. സോ ഒരു കിളന്ന ഡോക്ടർ മോഹനുണ്ടല്ലോ, ശരത് ഡോക്ടറിൻ്റെ നമ്പറും എനിക്ക് വാങ്ങിച്ചു തരണേന്ന് പറഞ്ഞു. So this is what she had said, that the one who was tall, she had never seen her face. One who was very tall, means compared to others, she wanted to see him, and us also. So the second day she told, we'd like to see your faces. So after we had planned for discharge, at that time when we had posted to discharge them after the medical board on 30th, Sergeant sir asked, tomorrow you all have to come, because they hadn't seen your faces, no one's faces. They had seen only the PP kit, not even our eyes. So you have to be there before they go. go back. And when they came out of the rooms, Rijo has taken a selfie video. Then there was a long prayer, and in that prayer they included us also, and they thanked us all. It's not like they had thanked only God, they had thanked us also. And they were really grateful to all of us, especially Ashish sir and Sergeant sir, because they know the commodities, how they are getting the commodities and all. So they were very happy with that. And from there we maintained a distance and came down. When we came down, all the hospital staffs were there, not the isolation staffs alone. So then you know the history.